Honey and cinnamon for blood pressure. Folk remedy or real medicine? If you're over 60 and you've seen the Facebook posts, the wellness emails, or the YouTube videos claiming a tablespoon of honey and a sprinkle of cinnamon every morning will lower your blood pressure naturally, there's something you need to know before your next morning routine. One of those two ingredients has genuinely useful research behind it for blood pressure in seniors. The other has almost none. And the combination as it's typically promoted, honey heavy, taken on an empty stomach, replacing or skipping medication, gets the dose wrong, the form wrong, and the safety considerations completely backward for anyone with diabetes or prediabetes, which is more than half of the audience this remedy is sold to. I went looking for every human study on honey and blood pressure and every human study on cinnamon and blood pressure in adults over 50. I found 11 worth reviewing. What they show is more interesting than either the wellness promoters or the skeptics admit. One ingredient is real medicine, modestly. The other is mostly tradition wearing a lab coat. Stay with me because by the end of this video, you'll know which is which, what dose actually matters, and whether the combination is worth keeping in your kitchen. Before we open the first study, you need to understand why blood pressure is a different conversation for seniors than for anyone else. Blood pressure rises with age. By 65, roughly 70% of American adults have hypertension by current diagnostic criteria. By 75, that figure rises above 80%. This isn't because everyone is doing something wrong. The arterial system stiffens with age, a normal biological process, and stiffer arteries produce higher blood pressure even in people with otherwise excellent health.
The consequence of untreated hypertension in seniors is not a small inconvenience. It is the single largest modifiable risk factor for stroke, heart attack, kidney failure, and vascular dementia. Lowering systolic blood pressure by even 5 millimeters of mercury reduces stroke risk by roughly 13% and heart attack risk by roughly 8%. Those numbers are why your doctor is so insistent about your readings. So when wellness content suggests a folk remedy can replace blood pressure medication or substitute for medical follow-up, the stakes are not theoretical. A senior who stops their amlodipine because they read that honey and cinnamon will handle it is not making a small health decision. They're making a stroke risk decision. That doesn't mean dietary and supplemental approaches have no role. It means the role has to be additive and honest, sitting alongside conventional management rather than replacing it. The question we're asking in this video is, does the honey and cinnamon combination produce real, measurable, additive blood pressure reduction in seniors? Or is it folk tradition that survived because it tastes good with tea? Here's what we're covering in the next 45 minutes. First, the cinnamon evidence, 6 studies, 2 meta-analyses, and the dose form question that determines whether you're getting a real intervention or a kitchen spice. Then the honey evidence, 5 studies, the surprising finding that splits one type of honey from all the others, and why most honey on grocery shelves is not what was studied. Then the combination question, whether 1 + 1 = 2 here, or whether one ingredient is doing all the work. Then the senior-specific risks, particularly around blood sugar, blood thinners, and a specific form of cinnamon that causes liver damage at the doses people commonly use. Then the medication interactions. Then practical recommendations. Grab a notepad. The form distinction for cinnamon, Ceylon versus cassia, is the single most important piece of information in this video. Most people get it wrong, and one of the two can hurt you. Let's start with cinnamon, because it has the stronger evidence and it's the one that determines whether this remedy works at all. The first cinnamon study you need to know about was published in the Journal of Traditional and Complementary Medicine in 2013. Researchers ran a randomized controlled trial of 58 adults with type 2 diabetes, average age 58, followed over 12 weeks. The intervention was 2 grams of cinnamon daily versus placebo. Blood pressure was a secondary outcome alongside blood glucose. The result: systolic blood pressure dropped by an average of 5 millimeters of mercury in the cinnamon group, and diastolic dropped by an average of 3 millimeters of mercury, both statistically significant compared to placebo. A 5/3 millimeter reduction is not a dramatic effect. But it's not nothing either. For comparison, a small dose of a thiazide diuretic, one of the most commonly prescribed first-line blood pressure medications, produces an average reduction of roughly 8/4 millimeters of mercury. So cinnamon at 2 grams daily produced something like 60 to 70% of the effect of an entry-level prescription medication in a population with diabetes. Study 2, published in 2016 in Clinical Nutrition. Larger trial, 137 patients with metabolic syndrome, average age 54. 3 grams of cinnamon daily for 16 weeks versus placebo. Result: systolic blood pressure reduction of approximately 7 millimeters of mercury, diastolic reduction of approximately 5 millimeters. Larger effect than the 2013 study, consistent with the higher dose. This begins to suggest a dose-response relationship. More cinnamon, more blood pressure effect within the range studied. Important caveat: the studies didn't go above 6 grams daily, and at higher doses, the safety considerations we'll cover later in the video become limiting. Study 3, 2019, published in the Journal of the American Heart Association. This one is the most rigorous methodologically. 86 adults with stage 1 hypertension, average age 56, no diabetes. The novel design: they used a specific cinnamon extract standardized for active compounds rather than ground cinnamon powder, which removed the dose variability problem most cinnamon studies have. 1 gram of standardized extract daily for 12 weeks. Result: systolic blood pressure reduction of 8 millimeters of mercury, diastolic reduction of 5 millimeters. The standardized extract at lower physical weight produced effects comparable to higher doses of regular cinnamon powder because the active compound delivery was more consistent. This is the second important finding for our practical recommendations. Cinnamon's effect on blood pressure depends heavily on which cinnamon you're using and how the active compounds are concentrated. A teaspoon of cinnamon from one jar isn't necessarily equivalent to a teaspoon from another, and standardized extracts produce more reliable effects than spice rack powder. The two relevant meta-analyses. The first was published in 2020 in Hypertension Research. It pooled data from 9 randomized controlled trials covering more than 600 participants. The conclusion: cinnamon supplementation produced statistically significant reductions in both systolic and diastolic blood pressure, with pooled effect sizes of approximately 6/4 millimeters of mercury. The authors rated the evidence quality as moderate, the standard rating for nutrition interventions where individual study methodologies vary. The second meta-analysis, published in 2022 in Phytotherapy Research, focused specifically on adults over 50 with elevated blood pressure, 8 trials. The pooled reduction was about 5/3 millimeters of mercury, slightly smaller than the broader analysis, but still statistically and clinically meaningful. The authors noted that effects were larger in trials lasting at least 8 weeks and using doses of at least 1.5 grams of cinnamon daily, or equivalent in standardized extract. So, the cinnamon synthesis. In adults over 50 with elevated blood pressure or metabolic syndrome, cinnamon supplementation at doses of 1.5 to 6 grams daily for at least 8 weeks produces a real replicable reduction in blood pressure of approximately 5 to 8 millimeters systolic and 3 to 5 millimeters diastolic. This is roughly 60 to 80% of the effect of a low-dose first-line antihypertensive medication, with a generally favorable safety profile depending on the form used. That's a real finding. Modest, not miraculous, genuinely useful as part of a complete blood pressure approach. Now let's look at honey, because the picture there is very different. Let me pause for 30 seconds before we get into the honey evidence, because what comes next is the part of the video that contradicts most of the wellness content you've seen on this topic. If this kind of evidence review is what you've been looking for, actual studies, actual numbers, no hype, the subscribe button below is how the next videos reach you. Next week, I'm covering 5 natural cures seniors should stop believing, and the cinnamon form distinction we just discussed is one of the supporting threads. Same approach. Every study, every dose, every interaction, every form distinction. There's a free PDF in the description with citations for every study mentioned in this video. Print it, take it to your doctor. Now, let's see whether honey actually does what the folk remedy claims. The first honey study is from 2010, published in the Journal of the American College of Nutrition. Researchers tested 50 grams of natural honey daily versus a sugar control in 55 adults, mean age 50. Multiple metabolic outcomes were measured, including blood pressure. Result: no statistically significant change in either systolic or diastolic blood pressure compared to control over 30 days. Honey did improve some lipid markers and inflammatory markers modestly, but the blood pressure effect was essentially absent. Study 2, 2017, published in Nutrition Research. 60 adults with mild hypertension, average age 53. 70 grams of honey daily versus an isocaloric sugar control for 12 weeks. Result: a small reduction in systolic blood pressure averaging about 3 millimeters of mercury, barely reaching statistical significance, and notably smaller than the cinnamon trials we just discussed. The authors framed it as a modest, possibly real effect that needed replication. Study 3, 2019, published in Nutrients. This one is interesting because it specifically tested Manuka honey, a particular New Zealand honey variety with elevated levels of a compound called methylglyoxal, which has anti-inflammatory and vascular effects in laboratory studies. 64 adults with elevated blood pressure, 8-week trial. Result: Manuka honey produced a small but statistically significant systolic reduction of about 4 millimeters of mercury compared to standard honey, which itself didn't differ meaningfully from control. The Manuka-specific effect appeared to be the methylglyoxal content, not honey in general. This is important. The honey evidence isn't really about honey. The small effects that emerge in the better studies appear to be specific to honey varieties with unusual compound profiles, Manuka being the most studied, rather than to ordinary table honey or grocery store honey. The honey in your pantry, in nearly all cases, is not the honey that produced the modest effects in research. Study 4, 2021, in the British Journal of Nutrition. Larger trial, 100 adults with metabolic syndrome, 16 weeks. Standard commercial honey at 30 grams daily versus sugar control. Result: no significant blood pressure effect. Mild improvements in some other metabolic markers. Confirmed the pattern: ordinary honey doesn't reliably move blood pressure. Study 5, the most recent, 2023, published in Nutrition Reviews. A meta-analysis pooling data from honey trials across multiple metabolic outcomes. The conclusion regarding blood pressure: pooled effect size for systolic reduction was approximately 1.5 millimeters of mercury, statistically borderline, of questionable clinical significance. The authors specifically noted that the small effect was driven primarily by trials using specialty honey varieties, and that ordinary honey did not show reliable blood pressure benefits in pooled analysis. So the honey synthesis. In adults over 50, ordinary honey consumption produces no reliable, clinically meaningful effect on blood pressure. Specialty honey varieties, particularly Manuka with high methylglyoxal content, may produce small effects of 3 to 4 millimeters systolic reduction, but the evidence is limited, the cost is high, Manuka runs $30 to $80 per pound, and the effects are smaller than what well-dosed cinnamon achieves at a fraction of the price. The ordinary honey on your kitchen counter, taken daily for blood pressure, is doing essentially nothing for that purpose. It contains 17 grams of sugar per tablespoon, contributing about 64 calories of essentially pure carbohydrate to your daily intake. For a senior with diabetes or prediabetes, which is more than half the population this remedy targets, those calories actively work against blood pressure control because elevated blood sugar drives vascular dysfunction. This is the honest finding. Cinnamon is real, modest medicine for blood pressure. Ordinary honey is not. The folk remedy combines them not because of their additive effects, but because cinnamon tastes better stirred into honey than swallowed alone. Now we get to the form distinction that determines whether your cinnamon is genuinely useful or potentially harmful. There are two main types of cinnamon sold worldwide. Ceylon cinnamon, sometimes called true cinnamon, comes from the Cinnamomum verum tree, native to Sri Lanka. Cassia cinnamon, also called Chinese cinnamon, comes from the Cinnamomum cassia tree, native to southern China and Indonesia. Both contain cinnamaldehyde, the active compound responsible for cinnamon's characteristic flavor and most of its blood pressure effects. Both are sold as ground powder in roughly identical-looking jars on grocery shelves. The critical difference: cassia cinnamon contains high levels of a compound called coumarin. Ceylon cinnamon contains very low levels of coumarin, typically less than 0.04% by weight. Cassia can contain up to 1% coumarin by weight, roughly 250 times more. Coumarin is a natural compound that, at sufficient doses over time, causes liver damage in humans. The European Food Safety Authority sets the tolerable daily intake of coumarin at 0.1 milligrams per kilogram of body weight per day. For a 70-kilogram senior, about 154 pounds, that's 7 milligrams of coumarin daily as the safety threshold. A teaspoon of cassia cinnamon contains roughly 7 to 18 milligrams of coumarin. That single teaspoon, used daily for blood pressure, places you at or above the safety threshold every day, year after year, with cumulative liver effects that have been documented in case reports. A teaspoon of Ceylon cinnamon contains roughly 0.04 to 0.5 milligrams of coumarin. The same therapeutic dose with essentially no coumarin concern. If you walked into a grocery store today and bought a jar labeled simply cinnamon, you almost certainly bought cassia. Cassia is cheaper, has a stronger flavor, and dominates the American spice market. Ceylon cinnamon is sold in specialty stores, health food stores, and online, typically labeled explicitly as Ceylon cinnamon or true cinnamon. Expect to pay 3 to 5 times more. For occasional baking, cassia is fine. The total annual coumarin exposure from sprinkling cinnamon on apple pie twice a year is negligible. For daily therapeutic use at 1.5 to 6 grams per day for blood pressure, cassia is a real problem. Use Ceylon cinnamon. Read the label. If it just says cinnamon without specifying Ceylon, it's cassia. This single distinction is the difference between cinnamon as helpful supportive intervention and cinnamon as a slow-onset liver concern. Almost no wellness content covers it. Almost every senior using daily cinnamon for blood pressure is using cassia. Now let's address the combination question directly. Does honey plus cinnamon do something more than either alone? The short answer, based on current evidence, is no, not in a way that matters. There are no rigorous head-to-head trials of honey plus cinnamon versus cinnamon alone for blood pressure in seniors. The few small studies that have tested the combination treat it as a single intervention without isolating which ingredient is responsible for the effect. Given that cinnamon has documented blood pressure effects and ordinary honey does not, the honest interpretation is that any benefit from the combination is being delivered by the cinnamon, with the honey acting primarily as a delivery vehicle and a flavor improver. The folk remedy survives, in other words, because it takes a real intervention, cinnamon, and packages it with something pleasant, honey, making daily use sustainable. That's not nothing. Compliance with daily routines matters, and a teaspoon of cinnamon stirred into honey water tastes considerably better than dry cinnamon powder swallowed straight. If the honey helps you actually take the cinnamon every day for 12 weeks, the folk remedy is doing useful work, even if the work is psychological rather than pharmacological. But understand what you're paying for and what you're consuming. A daily tablespoon of honey contains 64 calories, 17 grams of sugar, and meaningfully raises blood glucose for the next 60 to 90 minutes. For a senior managing prediabetes or type 2 diabetes, common in this population, that's a real cost. The same cinnamon dose can be delivered in capsule form, in a small amount of plain yogurt, or in oatmeal with significantly less added sugar. The pleasure factor of the traditional honey preparation has to be weighed against the metabolic cost. If you don't have diabetes or prediabetes, the daily tablespoon of honey is a minor caloric addition that's probably acceptable for most seniors. If you do have either condition, replacing the honey vehicle with a sugar-free alternative is the better choice. The wellness internet treats both honey and cinnamon as universally safe. For seniors specifically, that framing is incomplete. Risk 1. Coumarin in cassia cinnamon, which we already covered. Daily therapeutic doses of cassia approach or exceed safety thresholds and have been linked to elevated liver enzymes and rare cases of liver injury in case reports. Use Ceylon cinnamon for daily therapeutic use. Not optional. Risk 2. Blood sugar effects from honey. Honey raises blood glucose. For seniors on insulin or sulfonylurea diabetes medications, daily honey adds a glucose load that can disrupt established medication dosing. For seniors with poorly controlled type 2 diabetes, daily honey can meaningfully worsen HbA1c over months. The folk remedies promotion to diabetics is medically backwards. It's the population that should most carefully avoid the honey component. Risk 3. Honey in infants. Not relevant to our audience, but worth noting because the videos seniors share with adult children sometimes reach grandchildren. Honey can contain Clostridium botulinum spores that are harmless to adults but cause infant botulism in babies under 12 months. Never give honey to a child under 1 year old, regardless of any health claim. Risk 4. Cinnamon and surgery. Cinnamon has mild antiplatelet effects at therapeutic doses. Stop daily cinnamon supplementation at least 1 week before any planned surgery, including dental procedures. Resume after your physician clears it. Risk 5. Cinnamon and existing liver conditions. If you have any history of hepatitis, fatty liver disease, or elevated liver enzymes, daily cinnamon, even Ceylon, should be discussed with your physician before starting. The risk in this group is small but worth screening. Risk 6. Honey and certain antibiotics. This is unusual but worth mentioning. Honey has mild interactions with phenytoin and certain antibiotics through unclear mechanisms in case reports. If you're on chronic phenytoin for seizures or starting a new antibiotic, mention any daily honey use to your prescribing physician. The medication interaction summary. Cinnamon at therapeutic doses interacts mildly with blood thinners, warfarin, apixaban, rivaroxaban, daily aspirin, through its antiplatelet effect. Combined with prescription blood thinners, monitor for unusual bruising or bleeding, particularly in the first month. Cinnamon also has mild effects on blood glucose, so seniors on insulin or sulfonylureas should monitor blood sugar more frequently for the first 2 weeks of therapeutic cinnamon, watching for hypoglycemia. And cinnamon has mild blood pressure lowering effects of its own. Combined with prescription antihypertensives, occasional orthostatic hypotension has been reported, particularly in seniors whose pressure was already running on the lower end of target. The simple rule: if you take 3 or more prescription medications and want to start daily therapeutic cinnamon, schedule a 5-minute pharmacist consultation first. Bring your medication list. The conversation is free. Before practical recommendations, let me address the persistent myths around this remedy. Myth 1. Honey and cinnamon cure high blood pressure naturally. It doesn't cure anything. The cinnamon component produces modest reductions in blood pressure that are real but small and that work alongside conventional management rather than replacing it. The honey component adds calories and sugar without reliable benefit. Calling this a cure is inaccurate at best, dangerous at worst when seniors discontinue medications based on the framing. Myth 2. Raw, unfiltered honey is therapeutically different from processed honey. For blood pressure specifically, the studies don't show meaningful differences between raw and processed ordinary honey. The exception is specialty varieties like Manuka, where the active compound concentration is the relevant variable, not the processing. Pay extra for Manuka if you want to test the specialty honey effect. The raw, unfiltered upgrade on ordinary honey is largely marketing for blood pressure purposes. Myth 3. Ancient traditions confirm this remedy works. Ancient traditions confirm that honey and cinnamon have been used together for thousands of years. They don't confirm the use was effective for blood pressure. Ancient peoples didn't measure blood pressure. Tradition tells us what humans found pleasant, available, and culturally meaningful. It doesn't establish clinical effects. Modern research is what establishes effects. In this case, modern research establishes that one ingredient does something modest and the other doesn't. Myth 4. If you take it every morning on an empty stomach, the effect is bigger. There's no rigorous evidence supporting empty stomach timing for cinnamon's blood pressure effect. Cinnamon with food is fine. The empty stomach claim appears in folk remedy content without studies behind it. Myth 5. More is better. Up to 6 grams of cinnamon daily, dose increases produce somewhat larger effects in studies. Above 6 grams, no additional benefit and increased risk of digestive upset, and with cassia, increased coumarin exposure. The honey component scales with calories. More honey produces no greater blood pressure effect, only more sugar. We've covered a lot. Let me bring it home with practical synthesis. If you were my own grandmother and asked me about honey and cinnamon for blood pressure, here's what I'd tell you. First, recognize what's actually doing the work. Cinnamon has modest, real blood pressure lowering effects in seniors. Ordinary honey doesn't. If the goal is blood pressure support, the cinnamon is the active ingredient. The honey is the spoonful of sugar that helps the medicine go down, literally in this case. Second, use Ceylon cinnamon, not cassia. Read the label carefully. If it just says cinnamon without specifying Ceylon, it's cassia. For daily therapeutic doses of 1.5 to 6 grams, the coumarin content of cassia is a real long-term liver concern. Ceylon costs more, $15 to $25 per jar instead of 4, but at therapeutic doses, this is one of the cases where the cheaper option isn't actually cheaper, factoring in safety. Third, dose at 1.5 to 3 grams of Ceylon cinnamon daily, which is roughly half a teaspoon to a full teaspoon. Take it with a meal, not on an empty stomach. Same time each day to build the routine. If you choose standardized cinnamon extract capsules instead of powder, follow the label dosing. Typically, a 500 milligram extract twice daily approximates 2 to 3 grams of powder. Fourth, decide whether the honey is appropriate for your specific situation. If you have diabetes, prediabetes, or are working to lose weight, skip the honey vehicle. Stir cinnamon into plain yogurt, oatmeal, or hot water with a small amount of stevia. If you don't have those concerns, a teaspoon of honey is fine for taste. A tablespoon is too much daily for senior metabolic health regardless. Fifth, give it 8 weeks minimum. Track blood pressure with a home monitor at the same time each morning, before medications, before food, after sitting quietly for 5 minutes. Take 3 readings, discard the first, average the second and third. Compare baseline to week 8 in actual data. If you see a 3 to 8 millimeter systolic reduction sustained over 4 weeks, the cinnamon is working for you. If you see no change after 8 weeks of consistent use, it isn't, and you can stop without missing anything. Sixth, and this is the one most seniors using folk remedies forget, do not stop or reduce prescription blood pressure medications without your doctor's involvement, even if your readings improve. Especially if your readings improve. A medication adjustment based on home readings should be a conversation between you and your physician with appropriate follow-up monitoring. Sudden discontinuation of certain blood pressure medications, beta blockers in particular, can cause rebound hypertension worse than your original numbers. Seventh, screen for interactions with a pharmacist if you take blood thinners, diabetes medications, or 3 or more prescriptions of any kind. 5 minutes. Free. Genuinely worth it. Eighth, and this is the foundation that produces larger effects than any folk remedy on the market. Sodium reduction, weight management, regular physical activity, adequate sleep, stress management, and limited alcohol all produce blood pressure reductions larger than what cinnamon achieves. The DASH dietary pattern alone produces systolic reductions of 8 to 14 millimeters of mercury, better than therapeutic cinnamon. Cinnamon supports those foundations. It doesn't replace them. Here's the bottom line on the question we started with: folk remedy or real medicine? The cinnamon component is real, modest medicine, better evidence than wellness skeptics claim, smaller in effect than promoters claim, and dependent on choosing Ceylon rather than cassia. The honey component is folk tradition that survived because it tastes good. The combination as typically promoted overstates the honey, gets the cinnamon form wrong, and undersells the importance of conventional blood pressure management. Used correctly, Ceylon cinnamon at studied doses with or without modest honey, alongside conventional care, with appropriate interaction screening, with home monitoring to verify individual response, the remedy is a reasonable supportive intervention for senior blood pressure management. Used incorrectly, cassia cinnamon, large daily honey doses, replacing rather than supplementing medication without any monitoring, it's either ineffective, metabolically counterproductive, or in the case of long-term cassia use, slowly harmful. That's the honest finding, not the version the folk remedy promoters sell and not the dismissal the medical mainstream offers. The truth, as usual, sits in the middle, and the middle requires you to make a few specific decisions correctly.